Henry Bugembe on his red motorcycle became a familiar sight in the town of Nakawuka during Uganda's lockdown last spring. With public and private transportation banned at the time and few ambulances, the volunteer health worker used a rare pass and the motorbike to drive people in need to hospital.
Existence of COVID-19 didn't stop people from suffering from other diseases, but it was very hard for someone to travel, to go to the hospital.
He also delivered medicine, a vital service in a country where 1.4 million people are living with HIV. Critics blame the heavy-handed lockdown for unnecessary deaths. But predictions that COVID-19 itself would completely overwhelm African nations with fragile health systems haven't been borne out. The Uganda Virus Research Institute in Entebbe is the main testing facility.
I think what is happening in Uganda and many African countries, the infection may be spreading, but most of these are symptomatic or mild.
A young population, the median age across Africa 19, is likely one reason, he says. Another theory is that Africans might have existing immunities because of heavier exposure to other diseases. Uganda has recorded over 27,000 COVID-19 infections and 221 deaths overall. Doctors here admit the number of infected is likely much higher, but believe they'd see a higher mortality rate. Dr. Julius Latwama believes the infection's continued spread is worrying nonetheless.
The worry is with the health system. The health system is getting overwhelmed.
Uganda is a country of 42 million people and just 55 functioning intensive care beds. As countries like Canada and the United Kingdom roll out vaccines, Professor Kalibu admits there are worries Africa will be left out.
But overall, I think there's been international support. Now, as we're talking about vaccines, the discussions that are going on to ensure that low and middle-income countries are not left behind.
Henry Bugembe is still working to raise awareness about COVID-19, but says fewer people are willing or able to listen, their resilience fading. Margaret Evans, CBC News, Nakawuka.